So going back to a group of men that I worked with, or patients that I work with, people with borderline personality disorder, there does seem to be a strong association to childhood adversity. And it actually is a condition where there probably is a genetic vulnerability that interacts with that history to lead to the problems that we see clinically, including suicide ideation and behavior. So I think you have to expect that there probably is a trauma story, and you have to wait and be ready to talk about it when it comes. The one thing I'd say about safety, I often think about a patient that I was dealing with, that, you know, we need to make the relationship safe, and that's certainly a primary goal, to create the therapeutic relationship. But don't forget the external environment, because here I was waiting for this patient to open up, and he lived in a dangerous, unsafe environment, and there's no way he was going to be able to talk about his trauma until we dealt with the reality of his life. And then I agree with Zach, the timing is patient-driven. You have to be ready when the patient's ready. You know, in the essence is you want to walk with the patient through their trauma history with somebody they trust, somebody who can validate and empathize. And so it comes when it comes. I think it's also important to remember that, say, a patient who's at risk for suicide, or patients with borderline personality disorder, sometimes the exposure to the trauma history can be distressing and can even provoke suicide thoughts, self-harm behavior. So just have to be aware, and that's often why programs now combine trauma-informed therapy with things like DBT, because both elements are needed to bring the person to recovery.
I think those are great points. If I could just add one other comment, it would be that I tend to think about trauma quite broadly. You know, we often think about trauma in terms of, you know, sort of the big five: physical, emotional, and sexual abuse, and physical and emotional neglect. But I think there can be other experiences that people have that can be traumatic for them, and I think that we have to be sensitive to that, and, you know, be thoughtful and make use of our inferential skills when we're interviewing somebody and getting to know them, and, you know, to take a sort of broad view of what may be traumatic for a particular man.